As of this week, cases of COVID-19 in Pima County passed 10,000. New efforts to contain the spread include stepped up contact tracing. We learn more about how the county is adapting its response to the pandemic from Dr. Teresa Cullen, who leads the health department. There's a high number of cases of individuals who are asymptomatic. How exactly are they making their way to get tested and then they're positive?
I just had a discussion actually with one of our labs this morning that's reporting their asymptomatic patients. About 20% of them are positive when they test. The vast majority of those we don't know uh, definitively, but a lot of them are because people know of somebody who's been positive, like they may have worked at a business with them and they elect to go get tested. The testing sites are available on the ADHS website in Tucson, and many of them do not require you to be symptomatic to go get tested.
In Pima County, are you concerned that this region cannot sustain what we're seeing right now?
I am increasingly concerned. I call it a stable crisis, but we are definitely in crisis, and I have no qualms using that word. We need people to be aware that many of the hospitals on a daily basis are shifting patients, and people get good care in that process. I don't want people to worry about that. When a patient is transported, they're transported with the appropriate level of care around them, either by ambulance or by medical transport. But I am concerned. The good news about Pima County is we have close proximity to Maricopa County, and Maricopa County seems to have more ICU beds available than we do right now. It's hard to know what that reflects.
Last week, Vice President Pence said there would be support and resources sent to Arizona. To your knowledge, has that happened yet?
We had two DMAT teams come in. They came into Pima County. Yuma also got one. Disaster management teams. They're wonderful. I actually was the active duty public health service and had deployed with DMAT in the past. We had an ICU strike team come in. What that means, it's a team specific to support intensive care services. So these teams are working at two different hospitals in Pima County right now. We worked closely with the hospitals to identify their need. We also have gotten from the national stockpiles, we've gotten a shipment of ventilators probably 2 weeks ago. We have another one coming in sometime in the next 48 to 72 hours. So we're closely monitoring that. So when the vice president referred to that, I would assume he's referring to those two things that did happen.
Given that the resources are slowly starting to trickle in, the number of deaths are dropping ever so slowly. Are you hopeful about the weeks ahead?
I'm not hopeful right now, to be frank. Um, if you ask me, am I hopeful for a month from now? Yes. Right now, the numbers we've seen the last few days uh, do not show a stabilizing factor yet. Our early weeks, we had 200 to 250 on average cases a week. Now we have over 2,000. So people just need to be cognizant of the impact that puts on our hospital resources.
What sorts of things are you looking to? I mean, masks now, the majority of people are wearing consistently. Will that tell you something in the next week or so?
Yes. I think what we saw though is early on with the mask decision, there was not 80% of people wearing masks. I'm not sure it's 80% now, and that's about the number we need to get at. We talk a lot about other resources, and they're really helpful. We need to ramp up testing. We need to ramp up contact tracing. We need to ramp up all these things. But at the same time, we need the community to embrace what we know is needed right now.
Okay, Dr. Teresa Cullen from Pima County Health Department, thank you for your time.
Thank you. Appreciate it.